Hello everybody, welcome to this National Health Literacy Community of Practice. Great time in that it falls in Health Literacy Month, and like I say, great to see so many of you join today. My name is Emma Davidson and I'm the Strategic Manager for the North East and North Cumbria ICB's Health Literacy team. Um, um, so just and I'm going to be chairing today's community of practice. Just before we start, just to go through just a few housekeeping points, if that's okay. So everybody's microphones and cameras are off by default. It just works, helps manage the event with there being such a big group. If you do have any questions, you should be able to see a question and answer facility on your top bar. So if you just put any questions in there throughout the session, and we'll try and get to as many as we can. If you can't see the question and answer function, please email Yo-Yo Kwan and she'll be able to help you with that. So in terms of today's agenda, we've got 3 presentations for you. The first one is by Andrew Taylor, who's a specialist registrar in public health. He'll be telling us about their journey at Blackpool teaching hospitals for organisational health literacy. And then myself and Lorna Dawson will be telling you about some work, 2 reports that was commissioned by NHS England earlier this year. One of those was a scope and exercise to look at what does a national health literacy toolkit look like. And then the other one is what does a national health literacy training model look like. So we'll be taking you through a presentation of those reports. But without further ado, I'd love to introduce Andrew Taylor for you. Like I say, he's a specialist registrar in public health, and he's going to tell us about the work that he was involved in at Blackpool teaching hospitals. So I'll hand over to you, Andrew, if that's okay.
I was only explaining that I'm no longer at Blackpool teaching hospitals. In public health, we have to move from rotation to rotation, so I'm no longer there at the moment. So, but I was there for a year, and one of the projects I worked on was a health literacy journey. So, firstly, why health literacy? So Blackpool is the most deprived borough in England. More than half don't understand written health information. Almost 3/4 don't understand numerical information. And our aim was to shift our communication with patients so that it better reflects their literacy, their digital capabilities, and their communication needs. So those stats are all well and good, but basically all trusts have large cohorts of people who struggle to understand information, especially health information. And every trust really should be thinking about health literacy. A prerequisite to starting our journey was shifting the mindset. Our esteemed colleague, Dr. Mike Oliver, I don't know if you're familiar with Mike Oliver, delivered 2 workshops. He's a health psychologist. Delivered 2 workshops, one on health literacy awareness and one on organisational health literacy. Mike's really great at getting the message across, very engaging, very funny. And he highlighted the absurdness of everyday health communication. Some really funny sort of slides, really resonated with people. After each workshop, we surveyed attendees, and we found that their views initially aligned with what we call the personal definition of health literacy. But after both workshops, we could see that we'd successfully shifted mindsets, with thinking being more aligned with the organisational definition, which is the degree to which organisations equitably enable individuals to find, understand and use information and services to inform health-related decisions and actions for themselves and others. It's a mouthful, isn't it? It was clear that we'd generated something of a call to arms, a catalyst, if you like, to prioritising health literacy in everyday activities. People were basically saying, why are we not doing this? So the first thing we did, step 1, was to create a sense of urgency. At the workshops, we presented a readability audit. In advance of the workshops, we'd asked attendees to supply documents, which we put through the NHS readability tool, which is dead easy to use, by the way. And 92% of letters had an estimated reading age of over 15, and 48% of other documents came out as the same. Obviously, 15 is well beyond recommended levels for general accessibility. This resonated massively with our audience, highlighting the poor support of health literacy at the Trust, really. We also held discussions on barriers and enablers to health literacy and captured some really useful findings. And we also recognised that attendees were advocating for the development of some organisational pledges to serve as constant reminders of the Trust's responsibilities. The next step was building a guiding coalition. So leadership came through really strongly in our workshops. Getting board level support in the form of the medical director who came to the workshops and was our compere at the workshops. That was a real coup and hugely important. We also had public health team support. So myself and the Trust's public health consultant at the time, Dr. Heather Catt, we were sort of pulling the strings. And we had we still have a procedural documents and leaflets team, and they too were quickly on board, quickly incorporating use of the NHS readability tool when introducing or reviewing documents. And the Trust's Health Equity Network, basically a group of 50 quite key staff with an interest in health equity, they became our community of practice, a place where health literacy plans could be initiated and discussed. There's two sort of examples of our Health Equity Network group, the head of outpatients, chief nursing information officer. So our Health Equity Network already had quite key people with roles relevant to health literacy. Step 3 was forming our strategic vision. So we developed our 5 towers of health literacy. Towers, Blackpool. I know it's cheesy, isn't it? But these formed our 5 organisational pledges. To develop them, we considered the barriers and enablers that we'd identified at our workshops, as well as an analysis of friends and family test comments relating to health literacy. So the 5 key areas that they're listed: leadership, integrating health literacy into everyday core business, supporting the workforce, and committing to improvements in written information and verbal information. So this was my quite, I think, eye-catching design, which Mike Oliver did say made him smile when he first saw it. Our 5 pledges are there in the spirit of health literacy. They're quite short, punchy sentences using relatively simple terms. I'm not going to read them, but they've been presented to our. Excuse me, that was my phone. I'm not going to read them, but they're being presented to our Health Inequalities group, and we expect the board at BTH to ratify them. Step 4, though, was to enlist a volunteer army. So everyone who attended the workshops was nominated as a health literacy champion. We basically said, right, you know, one of the Trust champions. We added each person to our community of practice, which was our Health Equity Network list, and that list now comprises over 100 people. So it's basically doubled in size on the back of this work. And it's also much more diverse now in terms of more levels of the organisation being represented. So our health literacy champions, they've all been tasked with sort of expanding the membership using a matrix approach, so recruiting people from a broad spectrum of roles, sharing best practice and driving change. The next step was enabling action by removing barriers. So we did this by that gaining of the executive sponsorship, really important. Embarking on a program to revise letter templates and leaflets. That was via the procedural documents and leaflets office. Adding health literacy content to the Trust induction training. Developing intranet pages with signposting to resources. Gaining access to co-production and patient panel expertise. That was via Healthwatch and via Blackpool Council. Blackpool Council have a co-production team, and we sort of hooked in with those. And finally, developing an in-house Teach Back masterclass. This was developed by FY2 doctors on what's called an enhanced program. Obviously, Teach Back is a massive part of health literacy. Most of you will know that Teach Back is where clinicians give verbal instructions and get into the habit of asking patients to repeat back what they've understood. Really important, checking that people understand things. Massive part of health literacy. Next step was publicising some short-term wins. So we did this at our Health Equity Network meetings. We did this at our Health Inequality Steering Group, on our intranet pages, and we asked individual directorates to do it as well. We encouraged them to share these short-term wins at the directorate meetings. And I've listed some examples there of some of the short-term wins we had. Ophthalmic surgery, redesign of materials and pathways to reduce on-the-day cancellations, nutrition and dietetics review of guidelines and resources and their promotion of Teach Back, sexual health services, production of easy read patient leaflets, which they did they co-produced some easy read stuff with the Learning Disability Partnership, and bereavement services redesigned and simplified their bereavement advice booklet and also produced an accompanying video to go with it. Step 7 was about sustaining acceleration. So we had a celebration event in March this year, which sort of marked the end of the beginning of the journey, if you know what I mean, if that makes sense. We recapped our organisational health literacy progress. We showcased case studies. We presented our clinical support services division as a model for others to follow, and we publicised our 5 towers of health literacy. We emphasised ongoing efforts, such as the vast amount of work needed to simplify 300 plus documents, all identified as having too high a reading age. We identify future metrics such as improved attendance rates, fewer cancellations, and even lower printing costs. All things, all sorts of byproducts of improving health literacy. There's various metrics that sort of justify any cost, if you like. We identified routine health literacy initiatives to be embedded, such as collecting feedback on letters via QR codes, regularly reviewing signage, and increasing co-production, and increasing staff awareness and uptake of health literacy training. The final step is to embed the culture of it all. It's too early to fully judge cultural anchoring, but certainly commitment at the trust is evident. CSS have come up with a list of steps. That's our model division who really took health literacy on board. Clinical support services division. That's short for. They're a really good model for others to follow. That was their steps that I've listed there. I'm only going to read the top 2, which is recognise that organisational health literacy is a continuous journey, and health literacy is everyone's responsibility. Finally, I'm going to leave you with this. Apparently, we have a graphic designer at Blackpool Teaching Hospital, and he got hold of my original towers design and totally ruined it, and came up with this. And I'm going to leave that on the screen while we take questions. I think it's not as good as my original design, but I think we can work with it crudely. Yeah, I'll leave that. Shall we leave that on the screen while we take questions?
Thanks, Andrew. That's brilliant. Yeah, and great to hear about the great work that that was done. That's been started at Blackpool Teaching Hospital. So thank you for sharing that. Yeah, so just I'm just checking the question and answer function. We did have one question around accessing the readability tool, which obviously you've mentioned in your presentation. That's been Lorna's put a link to the tool in there. So yeah, that's a web-based tool that people should be able to access. I'll just see if it's so there's a new question just come in there. Alongside the NHS readability tool, are there any other audit framework to measure where the trust is with health literacy maturity? So yeah, I mean, Andrew, I don't know whether you want to answer that at all, but I can I can
Go for it.
thank you. Yeah, so yeah, so in terms of the readability tool, obviously that's measuring the readability of documents and things like that. There are other similar tools with that in that respect. I suppose a good guide for measuring where a trust is with in relation to health literacy maturity is sort of the 10 attributes of a health literacy organisation is sort of a good base to see where someone is amongst there. We're busy looking at there are standards out there as well. If there are health literacy standards out there, there's we looked into it. We've done a piece of work in terms of seeing what standards are available. Some of them there is a charge to using them, and they are other tools that just help you to see how you are against health literacy standards. In our region, I know we're planning to develop our own that are based on the needs of our sort of region and things like that. But the 10 attributes of a health literacy organisation are a good place to start. Just looking at a question that's just come in now, and this one's for you, Andrew. So someone just asking how this has been shared with the your ICB to help share it more widely around the sharing and implementation.
Basically, I have shared some of this work with. There is an ICB. I mean, your first step is to identify somebody at the ICB that's got an interest in this. Most ICBs have got population health teams. Yeah, we certainly our ICB has a population health team that deal with inequalities and that type of thing. And there usually will be somebody in that role who would have an interest in health literacy. So I guess your link would be find the person in the population health team who's responsible for health literacy and linking with them.
Brilliant, thank you. I can't see any more questions in the question answer function at the moment. What I will say is, so thank you, Andrew. If there's any more come in, for you, we'll send you them after the event if that's okay, and then we'll share question and answers with everybody afterwards as well, just so we don't miss any, if that's okay. Brilliant.
Magic, yeah, thank you. Thanks.
Brilliant. Thanks again for presenting.
Yes, thank you.
Thank
Pleasure.
you. So yeah, so thanks everybody. So yeah, we're going next on the agenda is for myself to take you through a piece of work we were commissioned to do by NHS England earlier this year, which was a scope and exercise to look at what does a national health literacy toolkit look like. So if you missed it earlier, my name's Emma Davidson, and I manage the North East and North Cumbria's ICB health literacy team. So I'm going to take you through this presentation. So just in terms of what I'll cover in this presentation, so just I'll give a bit of background about the work, look at why do we need a health literacy toolkit, what makes an effective health literacy toolkit, and talk through some key findings from our scope and exercise and recommendations that we made from that as well. So just in terms of the background to this piece of work, so like I say, earlier this year, our team in the North East and North Cumbria was commissioned by NHS England to do some health literacy work. So this included national webinars that were held in March, the scoping exercise on the development of a national NHS health literacy toolkit, which I'm going to talk through now, a national health literacy training model report, which Lorna's going to take you through, um, and a National Health Literacy Community of Practice and Support NHS Futures page, which have obviously all joined the Community of Practice today. So that's just a bit of background about where this work started from. But just to think about, why do we need a health literacy toolkit? So we all know that health literacy is a problem and it's something that we can do something about. So health literacy is a key driver of health inequalities. We know that research has shown that people with low levels of health literacy are more likely to have poorer health outcomes. So this might mean that they struggle to manage their own health or their family's health. They use fewer preventative and health promotion services and things like that. So this slide helps to just reinforce that. So people with low health literacy are more likely to suffer health inequalities, and people who suffer health inequalities are likely to have low levels of health literacy. And this is further reinforced by this slide. So this slide shows the relationship between people with low levels of health literacy and long-term health conditions. So again, research has shown that people with low levels of health literacy are more likely to have one or more long-term health condition. So with that, they have the complexity of more health, getting more health information that they need to understand, and they have more appointments to attend. So that just all adds to the issue. And there is research that's shown that there's certain groups that are more affected, more likely to be affected by low levels of health literacy. So these are shown in this slide. So in terms of people whose English isn't their first language, and people in lower grade jobs or in the top most deprived areas. And then looking at what this looks like as a percentage. So we know across the UK, 58% of adults struggle to understand health information containing words and numbers. So that's 6 out of 10 people who was affected. But we've shown, and like Andrew's shown in his slide, in some areas that's a lot higher. So it differs around the country, but on average across the UK, 58% of adults would struggle to understand information containing words and numbers. But then again, it's important to recognise that everybody can be affected by health literacy, and the World Health Organization gives examples of when this might happen. So for example, people aren't familiar with medical terms or how their bodies work. They're diagnosed with serious illness and are scared and confused. They're under stress and have to make important decisions, or they have health conditions that require complicated self-care. So we can see from all these slides that it's a problem, but we can do something about it. And just to remind everybody, everyone will be aware of this on the call, but the average reading age of adults across the UK is between 9 to 11 years old. But we rarely write at this reading age. So again, we've seen from Andrew's presentation that the audit they did, a lot of the materials were 15 plus, and that's been, we found that as well in audits that we've done locally, that information is rarely written at a reading age that's appropriate for our population. So we can do something about it, and people want to do something about it as well. So what was staggering is that we had over 2,000 signed up to the national webinars earlier this year about health literacy. The polls that we asked on those webinars, so 98% of the people responding said they wanted to see resources on a health literacy platform. 98% referred to wanting one or more resources. So that was really reassuring to show that and really reinforce that there is a need across the UK for health literacy tools and resources. And I think everyone will be familiar with this slide as well. So it's just nice to go back to at this point. So this diagram obviously shows health literacy in the middle. There's the skills of individuals and the communities on one side, but on the other side, it's what we as organisations and systems can do, and therefore showing the need for a toolkit to help us to do something to improve health literacy. Also, it was we could see from responses to poll questions that we used and surveys that there's a lack of awareness around health literacy tools. So less than half of people responding to the poll that we asked in the national webinars had used any health literacy tools in their organisation. So we asked some questions around, are you aware of health literacy tools and resources? And a common response was not yet, no, but I'd like to know more. And some people said, I'd like to start embedding their use as standard procedure as well, which again reinforces the need for a toolkit for health literacy. There's also a lot of national drivers to improve health literacy. So again, reinforcing the need for a toolkit to help people do health literacy work. I'll not read through all of these. But just looking at the World Health Organization, though they changed their mandate in 2021, so they put more focus to put more of a focus on organizations and their role in improving health literacy as well. The NHS 10-year plan as well talks about having a service equipped to narrow health inequalities, and we've already seen that health literacy is a driver of health inequalities, and it talks about services designed to tackle inequalities in access and outcomes as well. Also, when we talk about the NICE clinical guidance, just to use the one around consent and care to treatment, talks about staff understanding the importance of patients knowing what they're consenting to and signing up for as well. So as part of our work in the scoping exercise of what makes a health literacy toolkit, we wanted to look at what makes an effective toolkit. So Health Improvement Scotland advised using Morville's 7 core principles of user experience when creating a toolkit. So they talk about it being useful. So that's around your toolkit doing something that isn't already done by another toolkit. Where it says findable, so being able to find it and access it. Usable, so easy to use. Desirable, so set up in a way that's engaging, so use of images, things like that. Accessible for people who may have additional needs, so credible as well, so have confidence in where the information comes from. And valuable, so delivering on important goals, so helping you to get to where you want to be. So in this case, this toolkit helping us to be able to do health literacy work. The 7 core principles could be looked at under content, so valuable, useful and credible comes under content bracket, or usability was the findable, usable, desirable and accessible. So for our work, we focused on the valuable, useful and credible criteria as well. And the next slides will talk about those in a little bit more of what we looked at for those. So in terms of valuable, so I've mentioned this briefly before when we talked about how it's easy for an organisation to say how they are on their health literacy journey. So the 10 attributes of a health literate organisation are really the goals that the toolkit, that a health literacy toolkit should help users and organisations to deliver. So this just is a helpful diagram just showing the 10 attributes of a health literate organisation. So you've got leadership, like health literacy being part of planning, evaluating patient safety and quality improvement, health literacy training and support for staff, involving local people in design and making and evaluating information. So that's the credibility that I talked about before in terms of making sure the toolkit's credible, so really important in having an evidence base and also include involving local people and the people who need to use the tools in the development as well. Information is inclusive and accessible, speaking simply, making sure services are easy to navigate, and written information is written simply as well. So they are all part of the 10 attributes of a health literate organisation. So in terms of the useful criteria, so useful, again, just to remind you, so the useful criteria looks at something meeting a need that is not currently met by others. So again, just going back to the polls that I've mentioned earlier in the presentation, it was easy to see from the polls that we asked, that people were asking for a range of health literacy tools. So you can see there example business cases, case studies, training, evidence of impact. So there was 146 respondents to the tool, and like I say, guides and templates, there was about 89% of respondents were asking for those type of tools as well, and case studies were also highly requested as well. This is just a word cloud taken from questions that we asked in the national webinars about the types of tools of support that would help people to implement health literacy in their organisation. So senior level and organisational buy-in was mentioned. Training was a really popular response, and examples of written information such as leaflets and things like that. So examples of information written simply. As well. There was awareness of tools that existed, but maybe it's not full toolkits as well. And people pointed out that for a toolkit to be well used, it needed to be in one place and things like that, and easy and accessible as well. So in terms of the scope and exercise that we did, so we started with a literature search to find out what toolkits already existed. Across the UK and internationally as well. We assessed those toolkits as well that were found in the literature search against the criteria that I've spoke about. So are they valuable? Are they useful and credible criteria? We RAG rated them, so we give them a red, amber, green rating in terms of against those criteria. We talked about what that meant, and we did a bit of a gap analysis. So we looked at what the toolkits that were already there, what did they have, like what tools and resources did they have a lot of, where were the specific gaps, and from all of that work we were able to make recommendations as well. So the existing toolkits that we found are just listed on this slide here, and are useful for people to have a look at. When I talk about toolkits, I mean like full toolkits, because there's a number of health literacy tools and resources that we've already talked about, a readability tool and things like this. But when we talk about toolkits, we mean the full toolkit, which might include a number of tools and resources within them. So there was a World Health Organization toolkit, an NHS England Knowledge and Library Services toolkit, the Health Literacy Place toolkit, Community and Development and Health Network toolkit, City and Hackney, the Agency for Healthcare Research and Quality, the Better Health at Work Award, and the Cumbria Health Literacy Hello TAS toolkit around organisational health literacy. And this is just an example of how we assessed the existing toolkits against the criteria. So this shows a valuable criteria. And like I said, the valuable criteria means that the toolkit should deliver on important goals and impact. So in this case, help people to achieve the 10 attributes of a health literacy organisation. So this just shows how we rated them. So where they partially met that, so where they didn't cover something at all. So for example, leadership, that would have been highlighted as a no for some of the toolkits, or where it is covered. So you can see along one row, that was rated green, so that was covered within that toolkit, all of the leadership plan, evaluation, training and support, etc. So just to summarise some of the key findings from the scope and exercise. So what we found in terms of the existing toolkits that are available, most resources are really strong on communication techniques. So for example, writing simply, speaking simply, and so on. What was lacking in many toolkits was around tools and resources to help people get leadership and buy-in, planning, and then also navigation, so helping people access and find their way around buildings and things like that. And I think it goes back to so the leadership and buy-in and things, what is probably the most difficult to do is really change the culture of an organisation. And so what we found was that tools and resources to help with that were lacking in a lot of the existing toolkits. The NHS England Knowledge and Library Services Health Literacy Toolkit stands out as the most appropriate and robust resource, and the City and Hackney Health Literacy Toolkit also scored really highly with strong practical tools to use, with the Health Literacy Place Toolkit being a very credible option as well. What we found was that international toolkits, so for example the Hello TAS, would require modifications, so they would need to be adapted and changed to fit in with our NHS structures and things like that to make them useful for ourselves. And again, the community-based and workplace-focused toolkits, they provided really useful ideas, but then again, maybe lacked the formal links to the NHS, so again, would need to be adapted and changed as well, so that they were useful for us to help meet those the health literacy goals in a health literacy organisation. So in terms of recommendations from the work that we did, our overall recommendation that was a bespoke NHS health literacy toolkit is recommended. It's really important to find out who your users are and what they need. Yet, and to make sure that it's a credible resource. So in terms of what's mentioned further down around carrying out literature searches when developing specific tools. So as part of our work, we looked at existing toolkits, but our recommendations for people developing their own specific tools or resources is to carry out literature searches so that they are evidence-based and meet that credible criteria as well. The AHRQ Universal Precautions Toolkit and the Cumbria Hello TAS Toolkit should be used as key models because they met a lot of the criteria that we assessed them against. But although I've mentioned results to polls that we asked in the national webinars and things like that, another national survey would be really helpful to find out what local tools and resources are being used and are that have been developed that we might not be aware of. And again, that literature search can help with that. So if you are thinking of developing something local to help meet a need in your organisation, a literature search is really powerful to help you find out if work's already been done and things like that. When creating new materials, there needs to be a focus on leadership, planning and patient involvement to close the gap. So we talked about that gap analysis that we did to find out what there was strongly available in toolkits, and we've already highlighted that there was a gap between leadership, planning and involvement and things like that. The toolkit does need to focus on helping organisations meet the attributes of a health literate organisation. But the toolkits that we found in our search, it's helpful to review those to look at what can be adapted to look at what suitable content can be used. And also, as importantly, when tools and resources are developed, think about how they're accessed and how they're available to everybody as well. So that's the end of my presentation, but it would be really helpful just to find out from yourselves if you agree that if you think there is a need for a bespoke health literacy toolkit. So there's a poll coming up on the screen now, and also the question answer function if you would like to share your thoughts to that poll. That would be much appreciated. Thank you. Brilliant. Thank you. Yeah, thank you for listening to that presentation. We'll share copies of Andrew's and my presentation and Lorna's as well after this, and that will include references as well. There is also a copy of the full report available on the NHS Futures platform as well. So thank you, and I'll just check in the question and answer function if there's any questions at this point. Apologies if I miss.
I've been going through and answering whilst we've been going along, Emma.
Oh, brilliant. Thank you, Lorna.
And I think I've managed to catch all of them.
Brilliant. Yeah. So thank you. So I'll pass on to Lorna now to take you through her presentation. Thank you.
Thank you. I'm just going to move my screens around a little bit. So thanks, Emma. Hi, everybody. My name's Lorna. I'm the health literacy specialist in the regional health literacy team. And I'm going to talk about kind of the kind of sister report to what Emma kind of just presented, which was kind of what a national health literacy training model might look like. So yeah, we were kind of asked by NHS England to do this report last year. I have to say, like, so we don't know, kind of, we're not delivering this training model at the moment. At the moment, it's just what we think a good model would look like. So yeah, big caveat there. Cool. So what this will cover, just the reasons about why we need kind of like a training or a training model around health literacy, what the model might look like, how we'll try and tell if it's working, if it's making a difference, and also the kind of the next steps that we suggested in the report. So first of all, why do we need the training around health literacy? So in the presentation just before, Emma mentioned a lot of the national drivers around kind of doing health literacy, things from kind of like the NHS inequalities agenda to the CQC. So I'm not gonna go into those because I don't really want to repeat. But kind of at that national webinar that Emma talked about, where we kind of got feedback around a toolkit. So we also asked people kind of what they would want from a toolkit. And the second most popular answer was training. At that webinar as well, we asked people whether they'd done any health literacy training or not. So there were over 2,000 people who were at those webinars, and 73% of them said they hadn't attended any health literacy training. So I'd say that shows, and this is people who are clearly passionate about kind of health literacy. But yeah, there seems to be kind of like a lack of people who have actually done training in it. So kind of training itself is kind of definitely needed. We deliver training across the region, and I've put some quotes here, just kind of people who have said kind of this is a really important topic. They should be teaching at a university, needs to be in inductions and added to curriculums. And yeah, people just saying it needs to be more widely accessed. Yeah, kind of it's a big issue, but people don't necessarily kind of like see it, or it needs to be pointed out to them. So kind of verbal feedback, or kind of, yeah, feedback from training sessions of people saying, yeah, this is really important. Training also would help kind of people become kind of health literate organisations. So kind of in Emma's presentation just before, the toolkit was measured against those kind of attributes of a health literate organisation. So what we should be doing to be more health literate. And training feeds into this. So training is actually so one of the kind of attributes, so prepares the workforce. But it also helps support things like how do you communicate effectively? That's another of the attributes. Kind of how do you produce writing that is inclusive? Yeah, a content that is appropriate. Because a lot of people don't know how to do that at the moment. There's also kind of like the leadership angle, which we've kind of built into our kind of, yeah, model. So before we design a training, so we've got kind of like the why do we need to do it? Probably needs to meet these things that people are saying. So the training need and kind of meet helping people become a health literate organisation. But then it's important to think about who is this training actually for? There are lots of different ways of grouping staff. The way that kind of we chose was looking at existing staff and breaking them down very broadly. So if we were going to kind of do this in more detail and take it further, we'd probably have to break it down more than this. But looking at things like leadership and management, things like corporate or non-patient facing staff, front facing staff, and also estates and ancillary, because we felt that they would potentially need slightly different things from the training. I think it's also important to think about emerging staff. So at the moment, we're kind of we've got a problem, like loads of staff are in post, and we have to kind of train them. But what would be really nice is if we kind of train people whilst they're in training, so that eventually we don't necessarily have to do all the health literacy work further on. It's actually part of kind of training when people are doing courses and things. I guess at the moment, the best we can do is probably like put it in induction training. So think about our new starters. But it would be great if we could kind of like work with universities doing kind of all the different healthcare courses, and get it in kind of right from the beginning. There's also lots of external staff who work kind of in the NHS. We kind of said those were out of scope for this. And then actually, what do we want to achieve? So this is my real skeleton structure of a driver diagram. But I think basically kind of we want to raise awareness and skills in staff around health literacy. What that would result in is kind of better, clearer communication by kind of staff. And hopefully it means that organisations do health literacy better as well. They realise that it's a problem that they should do something about. And ultimately, we're doing this to improve patient experience, and also to help improve their health. And I guess as well, kind of improve staff experience. So those were kind of, yeah, the drivers, I would say. So with that in mind, what does our model look like? So we've gone for kind of 4 levels, I would say. So level 1 is kind of awareness, so giving staff knowledge of what health literacy is and why it's a problem. Level 2 is more skills based. So yeah, it's a problem, but how do you address it? So kind of speaking simply skills and writing simply skills. Level 3 is mastery. So that's kind of like the advanced skills. So if you're doing kind of like speaking to patients or kind of writing to people pretty much all day, every day, you probably need some kind of mastery training. And we also put kind of train the trainer in there, because kind of, yeah, we'd want it to be kind of a cascade model. And level 4 is kind of writing accreditation. So this is something that we do in the regional team and the trust team where I work. So we've got kind of a watermark, a health literacy watermark. So it's like a stamp that we put on any information that kind of meets our health literacy written standards. So we've got some training for people to be able to kind of achieve that and put that on their information as well. So I'm just going to explain those different levels in a little bit more detail. So with awareness, we kind of tried to think about who would get this training, or kind of what kind of like, yeah, different modules or categories within that would be. So there might be kind of a general awareness session for everybody, but kind of, as Emma said, kind of getting leadership and management on board is part of being a health literate organisation, and I think they'd probably want something nice and bespoke for them. So kind of have those 2 levels awareness. I think kind of just thinking practically, so there is e-learning available already. There's the NHS kind of half an hour e-learning on e-learning for healthcare. And that would be kind of like one of the easiest ways to kind of get lots of people clued up about health literacy quite quickly. So that would be a quick win. Some people like to do stuff live though, so live webinars would be a good way of doing it. I guess leadership and management, again, they probably want something special, so live webinars or face-to-face training might be kind of the offer that we propose for them. And then I've also kind of tried to suggest about who would actually do this training. Again, this is this is a recommendation. It's not what's going to happen. So kind of, it's a big model. It would take a lot to train the NHS. So kind of, it would make sense to have a national team kind of doing some of the training. My background is as an NHS librarian. And a lot of NHS library staff across the country do deliver health literacy awareness training. So they are an amazing resource that it would be good to draw on. So kind of, yeah, if you want to promote health literacy in your area, maybe have a chat with your library team, because you might be able to kind of do some of this already. As I said before as well, we really want to get people kind of doing this before they even work for us. So if we can work with kind of colleges and universities kind of doing healthcare courses, it'll be good for people to just have an awareness of health literacy, yeah, before they even come to us. So level 2 was the skills training. So we've broken this down to speaking and writing. I'd say speaking, we tend to find it works better on a kind of face to face, but we are looking at how we can deliver it online as well. And again, with writing, we do deliver that kind of online, but kind of face to face training can be useful. You'll probably see as we go through the levels, it kind of goes from kind of more e-learning, kind of self-directed, to kind of more face to face. And again, like for these ones, what we'd want is kind of to have trainers within organizations able to deliver these kind of skills training, particularly like the face-to-face training, for example. So that's where those are creeping in. And if we had like a national team, they would train those kind of organizational trainers. And they might be people like NHS library staff, could be learning and development. And again, it would be useful for kind of like students to learn these skills before they come. For example, junior doctors do kind of like a task. They at Sunderland anyway, they do a task on kind of writing a leaflet, and we've managed to kind of work with them to improve their writing and get them to write simpler. So level 3 is mastery. At the moment, I've got 4 different levels, but this could go bigger. I'd say, so for in the 10 attributes of a health literate organisation, there are certain types of conversations or kind of instructions that they highlight as being really important. 2 of those are conversations about consent and conversations about kind of taking medicines, how to take medicines. So I feel like those are really key kind of skills to get right. It's really key that you need to be explaining those things, kind of what's going to happen, what the risks and benefits are, or kind of what do you do with this medication when you get home. Yeah, it might be really important to have quite structured training on that. It's called mastery. It might not necessarily be mastery. It might just be a bespoke on this particular topic. Something that comes up time and time again as well is writing letters to the GP, so consultation letters or clinic outcome letters. We are told time and time again by the public that kind of I read it and it's gobbledygook, and GPs tell us that they have appointments where they're translating the letter. So it seems like there would be kind of a need for those. Because they're kind of more specific, I'd say probably want a national team to deliver those. But again, kind of things like consent conversations or kind of like medicine instructions, kind of we could introduce those on pharmacy courses, for example. And I think it would be important to do a train the trainer, and that would be kind of like could be delivered by a national team. And then we've got the kind of writing accreditation. So that's just one thing. At the moment, we run it it's over a period of, I'd say, about 8 months. It can be shorter, depends on how much writing simply you've done. But kind of a combination of online training to start with, get people used to the concept, then some face-to-face training where you kind of practice together. But a lot of it hinges on kind of people taking the writing simply techniques away and trying them out in their kind of general practice. So those are our ideas. It's a very whistle-stop tour. We also tried to map kind of who would get what type of training. I've not particularly included students on here, but I guess I've indicated that where it says, oh, this would be delivered by colleges and universities, I guess that's where you'd want kind of like to students. Like in all honesty, it doesn't really matter what type of staff you are. I'd say we probably all need to have a bit of general health literacy awareness and develop our kind of writing and speaking skills. But I guess it's where we come to kind of specific skills around talking about consent, or kind of writing doctor's letters, that we might want to kind of, target certain groups of people. So comms teams kind of write day in, day out. So they'd probably want to do mastery or the writing accreditation. And for example, HR, they're explaining people's rights. So we've worked a bit with our HR team. So they might want kind of more mastery on HR type documents. That may sound great, but we've got to tell kind of whether it's working or not. So we did make some recommendations for how to monitor and evaluate it. So yeah, just some suggestions about what we could count. So things like the number of people who we've trained or the type of training we've delivered. Probably be useful to understand kind of bits about the people that we're training. So we could kind of maybe approach certain groups of staff who are not really covered, or there are gaps in certain regions across the country. And then in terms of evaluation, we looked at kind of a 4-level approach. So one would just be kind of, how do people find the training? Do you like it? Do we need to make some changes to it? But also we want to tell if people have learned stuff. Are we, conveying it in a way that means people understand what we're saying? Then kind of more going into more impact. So have you changed your behavior? Are you doing things differently? We'd want to be kind of, it's all well and good kind of like people knowing this stuff, but are they doing something different now because of it? And we'd also like to say, has it made a change to the world? But kind of, did a conversation go different because you explained something in a different way? Kind of, what difference is it making? An example of this was kind of some training that we did in the regional team with some pharmacists. They were sending letters to patients. I think it was part of a GP practice. They were sending letters to patients about changing their medication, and they'd keep getting loads of phone calls because people didn't understand their letters. So I guess the thing that they were doing differently was they went on a how to write simply training. So they changed the way they wrote. And I think the difference that we'd hope to see, I'm not sure if we've heard back from them, would be that, they have less phone calls with patients ringing up, getting confused about their medications. So in terms of what next, these were our suggested next steps. So kind of find out what training already exists. So I've already said that lots of NHS library staff are already delivering kind of training. So you could go away and find out a little bit yourselves. But it would be good for us to find out if there are gaps in that model that we've created. If the model was to be delivered, you need to find some kind of like deliver. So again, kind of a bit of a mapping out what's happening already, what are the gaps, fill those gaps, how much training people have already had, and actually plan and deliver the model. So like Emma, I'm going to finish with a quick poll. That's okay. Kind of a scale of 1 to 5, with 1 is strongly disagree, 3 is and 5 is strongly agree. So thank you very much, everybody, for listening. I'm sorry I feel like I raced through that.
Thanks, Lorna. And again, there was questions popping up in the question and answer function as you went. So I've tried to answer as many as I can as I went. I'm just checking if there's any more. And thank you for there's been a link to the Directory of NHS Knowledge and Library Services that's been put in there. Thanks, Joanne. As well, Ranjit's helpfully just mentioned from NHS that health literacy is a key priority, and as well as obviously the community practice and NHS Futures, there's some work planned to revise the readability tool and update the e-learning resource used by NHS Library Services as well. So that's helpful to know. Just checking, have one last look for questions. Yeah, I don't think there's any more at the moment, but again, if anyone asks any more questions, if we don't get them during the session, we will review them all afterwards and make sure we've answered them fully and share the questions and answers with everybody afterwards as well. But thank you, Lorna. And just some final notes. So thank you again to Andrew and Lorna for presenting. It was really very much appreciated. So again, and thank you to all of you for attending today's event. So like I say, the recording will be available on the NHS Futures platform, and we'll also have copies of all of the speakers' presentations, and that'll include any references as well. The next date is in December, like I've just mentioned, so it's planned for the 8th of December as well, and we'll send out an Eventbrite link for those. Just a little reminder, so if you no longer wish to attend these meetings or receive any updates, please just let us know by emailing Yo-Yo Kwan, and she'll be able to make sure that you're removed from the distribution list.